Hi, it's Tom Salemi from OIS TV, here with Dick Lindstrom from the Minnesota Eye Consultants. Dick, thanks for leading this session this morning on innovative alternatives to drops. I thought it went pretty well. There's a lot of interesting ideas. You had conveyed a story about one of the problems with eye drops, which of course is adherence and misuse by patients. You had one patient who was applying the eye drops on their tongue, as you tell the story.
Right.
Is this merely an issue of misuse or failure to comply? If everyone used their eye drops, would we have no problems to worry about?
Actually, if everyone did use their eye drops according to the prescribed regimen, they are quite safe and effective, and we've got lots of data to show that. But we also have lots of data and clinical experience to show that patients either can't or won't take their drops. And so if you've got a blinding disease like glaucoma, even though you have an effective therapy in a drop form, if you don't take it, you still go blind.
So what are some of the potential solutions to this problem? We've discussed a few today, but what do you see as some of the real promising possibilities?
Yeah, there's a lot of exciting work being done in multiple areas, and they include placement of drugs into punctal plugs. There's a couple of companies working in that area. Placement of drugs into rings. There are subconjunctival injections. There are intraocular injections. There's placement of the drugs inside the eye for its extended release. So a lot of research trying to develop long-term therapies that will eliminate the compliance adherence problem we have with drops.
Will eye drops always be a part of the solution?
I think eye drops will always be a part of the solution. And for example, we have compliant patients, and I think probably many of us, if we had these available, would for those compliant patients still think of drops as an excellent alternative. But majority of patients, actually not the minority, the majority of patients are not compliant, and especially maybe in areas like post-surgical inflammation, surgeons would like to take control of that. They do a perfect cataract operation, everything's appropriate, and then if the patient doesn't adhere with their drops, they can get into big trouble, and I think most of us would like to eliminate that issue.
And this is really vexing because the drops have to be taken multiple times a day. It's not like you can send a nurse's aide to go by once a day to help them.
Yeah.
They usually have to be applied multiple times, right?
Well, that's right. Many of the drops, at least 4 times a day. We have learned that if we have drops that are twice or once a day, the patient compliance does go up. But, you know, that's the patients that can't take their drops. We have patients with senile dementia, patients with arthritis and the like, where absolutely they can't take their drops. But the biggest problem really is patients that can take their drops but don't take their drops. And but both are an issue, because if you don't treat yourself appropriately for inflammation and potential infection after cataract surgery, for example, endophthalmitis is a devastating complication. Cystoid macular edema is a devastating complication just because the patient didn't take their drops. And certainly visual loss from glaucoma, and then if we start looking at the retina, age-related macular degeneration and the like, we like to have things that didn't require the continuous injections either that are required in that group of patients.
And final question, are the reimbursements in place to help clear this logjam, or do we have to solve a financial problem too?
I think we have a financial problem to solve as well to some extent, and we actually need to I think re-educate our third-party payers that if we're providing a therapy that's an alternative to drops, perhaps it should be reimbursed like drops, and not bundled, for example, into the surgical procedures where it becomes an expense for the surgeon, which will, I think, short-circuit our ability to develop some of these innovative technologies.
Great. Well, thanks for joining us this morning and for leading a great discussion.
Great. It was fun. Yep.